For many nurse practitioner students, coming up with a diagnosis is a new task and something that they are unfamiliar with. And that was my case when I was a nurse practitioner student. Because when I was working as a nurse, there are always diagnoses, and I wasn't the one to make the diagnosis. But making a diagnosis is a crucial task for a nurse practitioner job. So in this episode, I'm going to share 6 tips to reach to the right diagnosis. Let's dive in. Aloha, I'm Miki Miura, a family nurse practitioner in Hawaii. I've been a nurse practitioner for 10 years and I absolutely love being a nurse practitioner and the lifestyle that Korea has given me. My passion is mentoring nurse practitioner students and new grad nurse practitioners to build amazing careers so that they can have the freedom of choice on what they want to do and how they want to live. All right, let's get into it. So in this episode, I'm going to share 6 tips to come up with the right diagnosis. First tip is to start thinking of differential diagnosis as soon as possible. When I say as soon as possible, that means that when you're prepping for the visit, so when you're checking to see what's the chief complaint, what's the reason for the visit, you may be reviewing the patient's previous notes, which you should. When you walk into exam room, you should ask questions based on differential diagnosis in your head. So let's say you are seeing 20-year-old female with prolonged period. Maybe you're thinking this could be side effect of birth control, then you should ask whether the patient is on any kind of birth control. Or maybe you're thinking this could be because of bleeding disorder, then you should tailor your question and ask about how long this problem is going on, whether the patient experienced other bleeding problems, or is she easily get bruised? And also you might want to ask if the patient had family history of bleeding disorder, such as von Willebrand disease. Second tip is to think about the most common diagnosis for the patient population and condition. We need to ask ourselves what would be most common. There are so many differential diagnoses, but out of that, what would be most common and most likely? For the example of 20-year-old with prolonged period, you may want to think about side effect from birth control and PCOS or polycystic ovarian syndrome. Some may think, what about ovarian cancer? If you research on ovarian cancer, although it is still a possibility and it will be in your differential diagnosis, ovarian cancer is rare for 20-year-olds. Therefore, it will be low in differential list. Unless patient has family history of ovarian cancer or any other symptoms suggesting ovarian cancer. So again, think about what would be more likely and common for this patient population. Third tip is to think about what would be most dangerous if you miss. What would pose immediate danger for patient if you miss diagnosing? For the example of 20-year-old with prolonged period, patient said she is sexually active, then you should think about ectopic pregnancy because ectopic pregnancy can be life-threatening and needs immediate treatment. If the prolonged period happens to a woman who is 45 and older, then the story is different. And especially if the patient had long history of infrequent periods. Then you should think about uterine cancer on top of your differential list because it is likely based on her age and menstrual history, but also it can be life-threatening. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews well so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. Fourth tip is to use symptom as diagnosis until you are certain. Some diagnoses require tests to confirm, while others can be made based on history and clinical presentation. If you are pretty certain of diagnosis, then you can use name a condition as diagnosis. For example, if you're seeing 30-year-old female with diabetes complaining of vaginal itching and vaginal discharge, which is like cottage cheese, and you perform wet mount and you see high fee, then you can put vaginal candidiasis or yeast infection as diagnosis. But if you are not certain of diagnosis, then you can use symptoms as diagnosis temporarily. So in the case of 20-year-old with prolonged period, you perform pregnancy tests and it was negative, so you can rule out ectopic pregnancy. Then now you decide to order some hormone testing like TSH and total testosterone to rule out PCOS. And you won't get the result right away. So for this visit, you can use abnormal uterine bleeding as diagnosis because you don't know what's causing this prolonged period yet. And related to that, the fifth tip is to know you don't have to come up with the right diagnosis with one visit. And sometimes it is not possible. I don't know if you ever watched House MD, but in certain cases, you have to go through differential diagnosis to come up with the right diagnosis. And I will be honest with patients, that is the process. I usually discuss what I'm suspecting the most, but also I'm thinking of some other conditions and order some tests to confirm. You may provide some treatment to patients while waiting for the test results if symptoms is severe or bothersome. And this is very important for shared decision making, which the current healthcare system is emphasizing. For example, if you see 28-year-old complaining of pain with urination or dysuria, and because patient is sexually active, you perform pregnancy test, it was negative, and patient denied fever, chills, back pain, nausea, vomiting, which can indicate pyelonephritis or kidney infection. Now you suspect she might have chlamydia or gonorrhea or UTI or urinary tract infection. Another differential is interstitial cystitis. You decide to order UA, urine culture, and chlamydia, gonorrhea PCR tests, but those tests usually takes up to 1 week to come back. Then you may discuss with patients pros and cons of waiting for the result to come back to treat or treat now, empirically, meaning based on assumption. So you may tell patient that you can give antibiotic for possible UTI, but con of treating right now without waiting for the result is patient may take antibiotics for nothing. Patient may develop drug resistance to antibiotics, and also she might have diarrhea as a side effect of antibiotics. While pro of getting treated right now is to lower the risk of developing pyelonephritis or kidney infection because she will get treated for UTI sooner. The last tip is to know that the follow-up is key to reach to the right diagnosis. You can schedule a follow-up appointment to ensure that the treatment worked and also to go over the test results. And you should also document that you recommended to come back within a certain period of time. If patient missed follow-up appointment, patient bears some responsibility in that outcome because patient didn't follow the recommendation that you gave. If you suspect life-threatening conditions such as cancer, you can also use reminder to remind yourself or task somebody to keep track to make sure the test results come back. If patient tries treatment but it didn't work, that also help you to reach to the right diagnosis because you know that wasn't the right diagnosis. I would also mention this to the patient in the beginning. So for example, if I see 35-year-old female with valvular itching, I may say, I'm gonna give you topical treatment for possible candidiasis and let's try it for 1 week. But if it doesn't get better, it can be eczema or contact dermatitis. So patient would know that if the treatment doesn't work, it doesn't mean that the provider, I didn't have a clue. Rather, it's the process of reaching to the right diagnosis, which is by trying medication to rule out conditions. As you can see, come up with the right diagnosis requires a solid knowledge base. This skill cannot be overcome overnight, and that's why it's very important to keep studying. I precept nurse practitioner students, and I usually task them to research on one topic per week and give me short presentation on the topic when they come back to the clinic next time. And they can present on prevalence, prognosis, how to diagnose, how to treat for the condition they are assigned to. I hope this video was helpful for you. If you like this video, give me a thumbs up and comment which tip was most helpful for you. Also, make sure to subscribe to my channel so you can get notification when a new episode is released. Alright, good luck and I'll see you in the next episode. Aloha!